Hello, I'm Harriet and I'm a nuclear medicine technologist. Now, you might be thinking, what on earth is that? But essentially, my role is part of scanning people. You will find us based in radiology departments in hospitals. Now, we do something called diagnostic imaging. So, we're looking for problems in the body that relate to diseases, for example, cancer or dementia. We scan people from the tops of their heads right down to their toes, and we use something called radioactivity to highlight these areas that might have the problem in. So we scan people's bones, brains, hearts, lungs, you name it, we scan it. Now, we're normally a team of either technologists like myself or radiographers, and we work together to produce these images. I knew from a young age that I wanted to do a job that helped others, and this does just that, and it's really interesting. As the science develops, so do we, and so does all of our equipment. It gets really clever. I didn't know what I wanted to do when I went to university. I actually ended up studying biology because that was something that I was interested in and what I was good at. But eventually I realised that I wanted to do some work with patients. I wanted to work with other people, essentially. I ended up doing a course in clinical technology with applied nuclear medicine, but you can get into this career pathway by just doing a degree in radiography. Normally, to do a degree like that, you would have to have some kind of science background, so maybe some science A levels, for example. There is another route to get into healthcare science, and that is to be a healthcare scientist. They have roles like this throughout the NHS, and normally these are on-the-job training schemes where you would do a degree at the same time as working. What I love about my job is that it's very rewarding. No day is ever the same. You get to work with lots and lots of different people throughout the whole hospital, and therefore it's just really interesting and varied. Now, my days are normally very challenging, and there's some parts to the job that are hard. For example, we see a lot of poorly patients every day. Now, these patients could be adults, they could be children, but they also could be patients that are on end-of-life care. So we see a lot of patients that are really, really quite unwell, and they need all the support they can get to get them through some of these tests that we do. The skills you need to do the job is you need to be patient, you need to be kind, and you need to have lots of initiative. You need to be particularly caring. However, that can be challenging some days if you're not feeling, for example, very lively, or if you're a bit tired. However, we always need to be our best person, best self, so that we can help our patients get through what is a really challenging time for them. It's often hard to find the perspective, but that's what we need to do each day, and we need to put ourselves in their shoes so that we can really appreciate what kind of service we're giving to them. If you were thinking about going into healthcare, I would say go for it. There's so much scope in healthcare to progress, to change, to adapt, and you'll never get bored. It must be one of the most rewarding professions out there, and I'm sure you won't regret it.